When learners are showing severe problem behavior that could cause harm to themselves or others, we may have to implement crisis intervention plans. But what are the best ways to do this? Hi, I'm Shira.
And I'm Shayna. We're behavior analysts who create weekly content about how to teach children with autism so that they make real progress. And we create shareable resources to make your job just a little easier. Today's topic is all about crisis intervention. And if you want more videos like this, make sure to subscribe and hit the notification bell to stay updated on new video releases.
So we kind of think about this as the way we practice a fire drill. For a lot of like schools and organizations, we have to go through a fire drill routine. Sometimes it's monthly in order to practice what would happen if there was a fire, because we don't want to be practicing it in that moment. We can't learn anything in the moment of an actual crisis. So we practice so that we can build those skills and know what to do when there might be a crisis. And it's similar for a lot of our students. Unfortunately, we experience some crises with our students, but what can we do to either prevent it or deal with it?
So the question is, what is crisis intervention? I think we all think about it a little bit differently, but in this context, we're really referring to just the treatment or reduction of challenging behavior that's usually disruptive and dangerous. We're really thinking about dangerous problem behaviors here. So that's what we're referring to as crisis intervention.
Yeah, and it's important to remember that sometimes these things can be unpredictable. Unfortunately, we can be involved in what's called the behavioral crisis. We may not be expecting it. And it's important to remember that it's the individual that's having a difficult time. They're not trying to give us a hard time. And it may come out in ways that show like aggression or really challenging behavior. We hope nobody gets hurt. But it's important to remember that we are supposed to be supporting the individual who is having a difficult time right now.
There's a really great visual. If you Google iceberg visual of disruptive behavior, it's a really cool visual. And it's basically thinking about an iceberg, and an iceberg that we can see, the part that we can see is, the student, having a tough time. They're, engaging in aggression, or, they're engaging in property destruction, self-interest behavior, those types of things. But the underneath part that we can't see is what's actually what they're experiencing. Like Shira said, it's them having a tough time. It's the anxiety piece. It's, feelings of whatever loneliness or nervousness or excitement, or there's a bunch of stuff going on below the surface that we're not seeing. And it's really important for us to be compassionate and really be understanding of that.
I almost feel like it's a similar visual in terms of what we do for crisis intervention, because so many people think that what we do is like this much of what they can see, which is the top of the iceberg, and it's deal with challenging behavior. And it's been a mind shift to support the staff in, they sometimes want us to come and have a magic wand. This child is suffering or struggling with something. So call the BCBA and they'll know what to do because they know how to manage challenging behavior. But so much of what we do is under the surface, in that most of our skill and the ways that we're most effective is in the prevention and the teaching side of the challenging behavior. And while we want to be able to be supportive and help our staff through the challenging moments, it's only a little bit of what we can be helpful with. Most of the time, it's trying to keep everyone safe and dignified and help support the student. That's best case scenario, but not much learning and skill development is going to happen in that moment.
Absolutely. And that's the really big thing, is we really need to understand when a student is having a tough time, that is not a teachable moment. It's not. You think about it. I joke around about, if I'm really heightened, or if I'm anxious, or if I'm in a bad mood. My daughter may have other choice words to say, but if I'm having a tough time, I don't want somebody else telling me what to do in that moment and trying to see if I'm learning from that. Because if someone's telling me what to do, I'm telling them where to go, right? It's not a teachable moment. So we need to understand that, the time to teach is when students are calm. It's, completely removed from, that instance. And it's, when they're in, a calm situation, when we can role play, when there's more rationality.
So we don't want to wait for somebody to be experiencing a crisis to notice that we need to teach them some skills. We obviously want to be more proactive. Sometimes it does take a crisis for us to, step back and evaluate and speak to the individual and the family as to let's get through this right now and doing whatever we can to keep everyone safe. But we also have to talk about what to do once this crisis has passed or this behavior challenge has passed. Right now, we do have to build up the skills because it can happen again if we're not teaching those skills proactively.
And for me, anyways, as a behavior analyst, it's really difficult for me to talk about crisis intervention without talking about setting events and teaching replacement behaviors and all of those antecedent strategies. Because in the moment, it's about keeping the student safe. It's about dignity. It's about, televisability. Hanley talks about in his today's ABA, his three core values. Televisability would be, if other people are watching and it's televisable, is that even a word? Are you doing things that look respectable? But really, it's client safety and client dignity and safety of everybody else around as well. But anyways, to my point, that's just such a small percentage of it. So yes, a crisis plan needs to take into account that C of the ABC, the consequence piece of it. But it's hard to just talk about that in isolation when you're not talking about antecedents and you're not talking about those setting events and replacement behaviors.
Right. So we could talk about, the crisis intervention trainings and ways that you can keep yourself safe and your staff safe, which is only one piece of it. But it's also really important to consider things like the universal protocol, which talks about reinforcing lower levels of behavior. Maybe for an individual who is susceptible to challenging behavior, we tell the staff not to wait until the behavior is very dangerous and reinforce at lower levels, or how to push through with the demands, or how to enrich the environment. So really thinking about putting in place a protocol that prevents the challenging behavior and still, like Shana says, preserves their dignity and relationship and safety. Because in the moment is not going to be the time to teach, but we want to prevent the challenging behavior, but also maintain the relationship.
And it's such a mind shift to go, what do you mean I'm going to reinforce negative behavior? I don't understand. But if, for instance, a student engages in severe negative behavior, like severe aggression, severe property destruction, you're not going to wait until they've escalated that much. I mean, it must be awful for the individual as well. They don't want to be doing that. But if you can see some precursors to that behavior, maybe it's, even just like a red face, or maybe it's, some sweating behavior, or it's a specific, way they shake their hands or something before, the real negative behavior starts, that's when you want to go in and reinforce that lower level, because it is a mind shift to do that. But it's because most likely they're going to engage in that problem behavior anyways. And then most likely that problem behavior is eventually going to get them what they want. So doing it at a lower level, it preserves their dignity. It's safety. It's safer to do that. So trying to write that into the protocol as well is a really good idea.
Right. So the other really important part of this is looking at a crisis as just the beginning. So once it happens, let's talk with the team and let's figure out, what does this tell us about the learner? What were they struggling with? What skills were missing? Putting it all into a plan that feels good to the team and that works on mostly preventative strategies. Like we keep saying, you're trying to avoid the crisis. And our focus is on building up the skills of the learner with that respect and with dignity.
For sure. And for more on client assent and dignity, you can check out other videos we've made in terms of how to maintain client dignity in ABA.
For more information on crisis intervention, click the link on or around this video or in the description to claim your free download on applying Universal Protocol. We also encourage you to subscribe to the channel so you don't miss any future videos, and leave a like and comment below if you have further questions.